Hey there, it's Dr. Jim. Thank you for stopping by. This episode is on a very serious clinical topic. It's geriatric malnutrition. A lot of people don't think of eating disorders as significant problems among elderly people, but I'm here to tell you that this is rather common. It's rather common. Good nutrition is critical for our overall health and wellness. Malnutrition among the elderly is a very serious issue. And being aware of and knowing the warning signs and symptoms may mean the difference between health and illness. If you know elderly people, if you work with elderly people, if you take care of someone, either professionally or at home in your family, then this is a good episode for you. Malnutrition among the elderly can be associated with a weakened immune system, an increase in infections, poor wound healing, weakened muscles, decreased bone mass, falls, fractures, risk of hospitalization, and an increased risk in death. And that's the short list. Malnutrition can also lead to a greater lack of interest in eating, making matters circular and much worse. Much worse. There are many causes of malnutrition. The underlying cause, the ultimate cause, is rather simple: little or no nutritional intake that leads to health problems. I mean, that's the bottom line. That's the most simple way of putting it. But beyond this, there are many physical, emotional, and social reasons why malnutrition occurs among elderly people. And most times it involves a combination of the following factors. Age. As we age, we face so many age-related health conditions that might interfere with diet and nutrition. Sometimes something as simple as dental problems, dentures, bad teeth, can make eating less attractive, really, and less enjoyable. Dementia can create many problems concerning our diet and eating and drinking, hydration, nutrition, all of that. Certain diseases and disorders can lead to decreased appetite. Let's not forget medications, and we know that elderly people are on a lot of medications, and some of those side effects, among a lot of those side effects, are decreased appetite, a decline in interest in eating because of the way the med makes us feel, so on and so forth. And we can't forget that as we age, we do experience a decrease in our senses, particularly taste and smell. So those all do play a significant role in malnutrition. A lot of elderly people have restricted diets. I mean, and the things that make food taste so good are fat and sugar and starches and carbohydrates and salt. And if you take all that away, I mean, I'm not saying to, pour salt down your throat and eat sugar every day, because that's not healthy either, right? Sugar is actually the enemy among all those things I just said. That's the real enemy, more so than salt or fat. And you know what? If you're 80, 85 years of age and your doctor says it's okay and your diagnoses are okay, so on and so forth with your diet, I think you should eat whatever the heck you want to eat, because having a little extra fat on your body as we age might save your life if you become very critically ill and you have to live on fat stores. But if individuals later in life have these highly restricted diets, they might just think, if it doesn't taste good, why bother, right? And there are other psychological factors as well, like depression and anxiety. I could go on and on and on about this particular topic, but my big takeaway is, if you do work with seniors, if you care for seniors, if you do know some seniors who live by themselves or whatnot, pop in on them, visit them, see what they're eating, ask them about their diets and their nutrition and their hydration, because it can make a big, big difference in their health as they age further. I'm Dr. Jim Collins. That's all I have to say. I could talk forever, but I won't. Thank you for your time and attention concerning geriatric malnutrition.